Every time you visit your doctor or pharmacy or any other healthcare provider, information is collected about you to help manage your healthcare. That information may also be used for health research and evaluation to improve the quality and efficiency of the healthcare system and for public health uses. But where does our health information actually go? Let's start with the visit to your family doctor. When you visit your doctor with some concern, your doctor will record information related to that concern in a file about you that is kept in the doctor's office. Your doctor may do some lab tests to gather further information. The lab will then take any necessary blood or urine or other samples. Once the test results are complete, a report will be kept on file and a copy will be sent to the doctor. Your doctor may also write a prescription for some medications. You would take that prescription to your local pharmacy. The doctor submits a bill to the provincial insurance program to get paid. The information provided includes only very basic information, such as the date of the visit, your health insurance number, and the main reason for your visit. The doctor's bill does not usually indicate what tests were ordered or what prescriptions were written. If you have drug insurance, the pharmacy provides a bill to the insurer. The information provided by the pharmacy includes your health insurance number, the drugs dispensed, the dose, and the amount of medicine. The lab also submits a bill to the provincial insurance program with information about what tests were done, when the tests were done, and your health insurance number. The information from the doctor, the lab, and the pharmacy is sent to different places, even if they are all government insured. Each of these bills is usually stored in different computer databases. This occurs separately in every province or territory across Canada. Sometimes you may need to go to the hospital, either for special tests or to be admitted to the hospital. At the end of your stay, the hospital prepares a summary of your visit. This information goes to the provincial insurer. However, unlike the laboratory and prescription information, the summary from the hospital is also sent to a place in Ottawa called the Canadian Institute for Health Information, where it is brought together to be used for research on quality of care. Some provinces have created special data centers where all these pieces of information are brought together. The information is compiled to create a more complete record of the care provided for an individual. The goal is not to follow the care of any one individual. Instead, it is to look at the care across thousands of individuals to see if certain patterns show up. Researchers analyze this collection of data files, for example, to study the quality of care provided or to identify unexpected side effects of medicines that people commonly take. Before any information can be released to researchers, plans for their research have to be approved by a research ethics board. The researcher must explain why it is not possible or appropriate to get everyone's consent, and how he or she will safeguard the information. Let's look at an example of how a researcher may use data to examine a healthcare-related problem. Several years ago, researchers studied the link between the use of long-acting sleeping pills and hip fractures from falls among senior citizens. To do this, researchers identified the records of seniors who were hospitalized for a hip fracture. They checked for any record of prescriptions dispensed for long-acting sleeping pills in the months before their fracture. They also looked up a random sample of records of seniors who did not have a hip fracture in the same time period and checked their prescription records for use of long-acting sleeping pills. Comparing the prescription records of long-acting sleeping pills in the two groups, the researchers found use of long-acting sleeping pills was twice as common among seniors who experienced a hip fracture than among seniors with no hip fracture. So, they recommended that doctors use either short-acting sleeping pills or some non-drug alternative for sleep. Increasingly, researchers are turning to data from the medical records themselves, especially as more and more hospitals and doctors are using electronic health record systems. This allows researchers to ask questions they could not ask before, and for them to do much more refined studies. You may be wondering if it is possible to identify you among the records in these large data centers. As the raw data come into the center to be linked, information like your name and health card number are still attached to your record. At this stage, though, only a handful of people are allowed to manage those records, and they work under a strict confidentiality agreement and high security. We call these people data custodians. Before a researcher is allowed to work with the data custodian removes your name and any other information that may directly identify you. However, it may still be possible to indirectly identify you by combining some of the remaining pieces of information. The most common examples include dates, like your date of birth, your sex, your full postal code, and any rare health condition you may have. The challenge is that these are also the types of information that researchers commonly use when doing their research. So, if the researcher needs any of this information, the data custodian needs to work out with the researcher how to make these pieces of information less identifiable, but still useful for the research. For example, there may be only one woman with the birth date of March 3, 1940, living in an area with a particular postal code. So, that person can be indirectly identified with only 3 pieces of information: date of birth, sex, and full postal code. However, there may be several people age 71, and even more in the age range 70 to 75 who live in that same area. The number of similar people will increase even more if we consider a larger area. So, by moving from date of birth to age, and then to age range, and by taking a larger geographic area, we can make your data less and less unique so that it becomes very difficult to identify you with your information. The challenge is the less detailed we make the information, the less useful it becomes to the researcher. So, there is a delicate balancing act between protecting your identity and keeping the information useful for the research that needs to be done. Expanding the age group and location categories you belong to are only 2 of many ways to protect your identity and still make it possible to do the research. We have shown how all the bits of health information that are generated about you get stored in different places, and how it is possible to combine these at a single data center, where they may be used for research and evaluation, after being stripped of directly identifying information and following approval from a research ethics board. These combined records are useful to teach us more about the safety of drugs and devices, their effectiveness when used under real-world conditions, and the efficiency of the healthcare system.